Hello. It's a pleasure to be here today with you all. I want to thank the DoD team for inviting me to share with you all the priorities from the Executive Office of the President. It's such a privilege to be among some of the brightest and most innovative minds to discuss the extremely important issue of biodefense. It's also an honor to share this panel with my esteemed colleagues, Dr. Matt Hepburn and Dasti Ian Watson. I have two objectives for today. The first is to explain the priorities within the National Biodefense Strategy and Implementation Plan and how this relates to DoD's mission and S&T innovation advancements. The second is to highlight key areas that the Biodefense S&T enterprise should focus on to advance the goals outlined in the NBS. So first, a note about the threat. I think this audience knows well that the biological threat is only growing. It's becoming more complex. It's becoming more sophisticated. The risk of another pandemic is increasing. As we all know, COVID-19 has devastated communities across America and around the world. Beyond COVID-19, the global community is concurrently fighting outbreaks of Mpox, polio, Ebola, highly pathogenic avian influenza, and other infectious diseases, stretching thin global resources and demonstrating persistent gaps in our preparedness. Further, biological weapons present an enduring challenge to our national security. We know multiple nations have pursued clandestine biological weapons programs, and a number of terrorist groups have sought to acquire biological weapons. In addition, advances in biotechnology, including synthetic biology, are making it easier to develop and use biological agents as weapons. Finally, in many countries around the world, pathogens are stored in laboratories that lack appropriate biosafety and biosecurity measures and could be accidentally released or diverted by actors who wish to do harm. To counter these threats, the Biden-Harris administration has released a series of plans to prioritize and align actions both within and outside the government. These plans serve as the roadmap to advance a cohesive set of actions to achieve biodefense results. Specifically, in October of this year, the Biden-Harris administration released the National Security Strategy, which describes how combating pandemics and strengthening biodefense are core components of national security. It calls for rapid detection, identification, and attribution of agents to reduce the risk posed by deliberate threats. The vision described in the National Security Strategy was expanded just 1 week later in October when President Biden signed National Security Memorandum 15 and launched the National Biodefense Strategy and Implementation Plan. You can find these documents online at whitehouse.gov. Together, these documents comprise the Biden-Harris administration's comprehensive plan to protect our nation from pandemics and biological threats. As you heard ASD Rosenblum say yesterday, the Department of Defense is a critical piece of the biodefense enterprise, as is this science and technology community that's assembled here today. The new National Biodefense Strategy outlines a bold vision and actions to create a world free from catastrophic biological threats. It aims to mobilize the biodefense community to transform the federal government's ability to prevent, detect, prepare for, respond to, and recover from biological incidents in partnership with our international, state, local, tribal, territorial, and private sector partners. It includes a concrete implementation plan that will drive a whole-of-government effort across over 20 federal agencies. The 5 overarching goals of the National Biodefense are: Goal 1, detect, ensuring awareness and early warning of pandemics and biological threats to inform decision-making across the biodefense enterprise. If we cannot detect an incident, we cannot respond. Goal 2, prevent, preventing epidemics and biological incidents before they happen, whether naturally occurring, deliberate, or accidental. Goal 3, prepare, preparing for epidemics and other biological incidents to reduce their impacts. Goal 4, respond, rapidly responding to outbreaks and biological incidents when they occur. As Dasti Watson just said, we know it is not if, but when. And Goal 5, recover, restoring the community, the economy, and the environment after a pandemic or biological incident. So let me give you some examples under each of these 5 goals. Under Goal 1, detect. The strategy aims to transform early warning and diagnosis of infectious disease threats by accelerating new technologies that can rapidly detect unknown pathogens in clinical and environmental settings. It also calls for investing in technology that will transform our ability to detect biological weapons use. These efforts will be integrated into the new Center for Forecasting and Outbreak Analytics to enable rapid, effective decision-making to improve outbreak response using data and modeling. Under Goal 2, Prevent, the plan prioritizes working with domestic and international partners to prevent laboratory accidents by strengthening biosafety, laboratory capacity, reinforcing norms of responsible conduct for research, and bolstering support for multilateral biosafety and biosecurity commitments. Of particular interest is the call to support innovation in biosafety and biosecurity, an action that is also included as part of strengthening the U.S. bioeconomy. This innovation includes evidence-based approaches to biorisk management and biosecurity approaches that keep pace with biotechnology advancements and the applications of other fields to biology, such as computation methods. The plan prioritizes working with foreign partners to prevent use and respond decisively if biological weapons are deployed, including taking every action to identify the offender and hold them accountable. It also calls for strengthening international norms against biological weapons, including through the Biological Weapons Convention, and the review conference is ongoing right now, to foster greater transparency amongst all nation states. This plan includes supporting at least 50 countries to strengthen their health security to prevent, detect, and respond to infectious disease threats. This significantly expands our global health security efforts. It further calls for encouraging other donors to support an additional 50 countries. We've already accomplished a major goal of our plan by leading the charge to establish the groundbreaking new fund for pandemic prevention, preparedness, and response at the World Bank. With more than $1.4 billion in seed funding at its outset, this pandemic fund will help fill major preparedness gaps at the national, regional, and global level. Under Goal 3, Prepare, the strategy includes a set of ambitious scientific capability breakthroughs to accelerate medical countermeasure capacity. It aims for timelines that may not be possible today, but can be achieved with the right resources over the next 5 to 10 years, including to, 1, enable pathogen-agnostic testing within 12 hours, surge to tens of thousands of diagnostic tests within 7 days, and develop rapid diagnostics within 90 days of determination of a nationally or internationally significant biological incident. 2, develop new vaccines within 100 days, manufacture enough vaccine for the population of the United States within 130 days, and work with international partners to develop sufficient vaccine supply for high-risk global populations within 200 days. And 3, accelerate therapeutic development for novel pathogens to repurpose existing drugs within 90 days and develop novel therapeutics within 180 days. Under Goal 4, Respond, these investments in preparedness will enable a more rapid response to outbreaks. To leverage preparedness capabilities effectively, the plan directs the interagency to maintain the capability to launch a coordinated, whole-of-government, equitable response to any significant biological incident within 7 days, with designated rules and responsibilities. It also plans for activation of an integrated federal research agenda and clinical trials infrastructure within 14 days to rapidly evaluate vaccines, therapeutics, and diagnostics during a response. Under Goal 5, Recover, the plan also addresses coordination and execution of a long-term, equitable recovery plan for any significant biological incident. This includes maintaining the capability to coordinate an evidence-informed mitigation effort within 7 days. These goals build on those outlined in the 2021 American Pandemic Preparedness Plan that Dr. Hepburn will expand on in a few minutes. The administration recognizes the importance of being able to prevent, detect, respond, and recover across the spectrum of biological threats, whether naturally occurring, accidental, or deliberate in origin. Many of the capabilities that we aim to develop and goals we look to achieve are broadly applicable across this spectrum of biological threats. Partnership is imperative, and we acknowledge that we must engage with academic, public, private sectors to best utilize these partnerships to execute this strategy. This conference is an excellent example of partnership, and the outcomes presented showcase the power of these partnerships. This is the broad overview of the policy context for national biodefense. I want to turn now to the National Security Council's perspective on what this community can do to advance our nation's biodefense. So first and foremost, as I've said, the Department of Defense plays a critical role in the United States biodefense enterprise. DoD's efforts and investments in scientific and technological research and innovation to counter biological threats have not only protected the warfighter, but have gone on to provide enormous public health benefits. For example, DoD has long invested in the development of medical countermeasures for Ebola virus. The vaccine against Ebola Zaire was able to be deployed in clinical trials during the West Africa Ebola outbreak in 2014 through 2016, and has since become a critical tool in responding to Ebola outbreaks and preventing further spread. I want to highlight a few areas within the MBS that may be of particular interest to this audience and where science and technology research and innovation are going to play a key role to advance U.S. capabilities. So first, on detection. We must transform the breadth and sensitivity of our current detection and biosurveillance capabilities so that we can identify a biological incident early, whether the agent is known or novel. This includes being able to detect a biological incident that may be a natural emergence, those that result from accidental release from a laboratory, or deliberate use of a biological weapons. This includes having fast, effective, and scalable diagnostic capabilities, including pathogen-agnostic and pathogen-specific approaches. Early detection is essential. It's in the initial stages of an event where actions to mitigate have the greatest impact. The faster we can detect, the faster we can characterize, and the faster we can develop countermeasures and take other non-pharmaceutical steps. Second, on attribution. We want to improve and transform our capabilities to attribute the origin of a biological agent. Attribution is most critical when a deliberate event is suspected. Critical capabilities needed include methods to detect signatures of genetic engineering or manipulation and agent-agnostic meta-based characterization of samples. Third, on countermeasures. The strategy calls for establishing a pipeline of therapeutics that are more broadly active to address concerns about novel pathogens and biological agents. It calls for investing in vaccine platform technologies that can be leveraged for existing and novel pathogens to include the ability to scale production quickly. So to reiterate, we can't achieve these goals to protect the United States and advance our biodefense capabilities without all of you. We need your help to push the bounds of the possible in order to protect not only the warfighter, but the general population against biological threats. Your efforts will drive advancements and ensure we can reach these goals. I want to conclude with a brief story. As I noted earlier, our partners in Uganda have been battling an Ebola outbreak since September of this year. The outbreak is Sudan Ebola virus, unlike the last several, which have been Ebola Zaire, and no licensed countermeasures exist today for Sudan Ebola virus. I was explaining this to my 7-year-old daughter about the outbreak, and when I told her no countermeasures were approved for Ebola Sudan, she looked me in the eye and said, "Not yet." It occurred to me that she saw medical countermeasures be developed and scaled in a matter of months, something that was unheard of prior to COVID-19. And we now have an entire generation that has witnessed rapid countermeasure development. While we have work to do to make countermeasure development faster, countermeasures more effective, more equitable, development in weeks or months, not years, is the new normal. And we have an entire generation that will hold us accountable to this goal, as well as propel us forward to achieve it. So in summary, you all are the cornerstone to help us realize what Carol Dweck has called the power of yet. We can't do it without you. We need your partnership to achieve transformational change. I look forward to hearing from you and to learning more about your work throughout the course of this conference. Now I will turn it over to my colleague, Matt, to further highlight S&T priorities from the Executive Office of the President. Thank you.